In our second section from the Psychological Disorders chapter, chapter 13, we are going to begin by talking about depressive disorders. And this section will run from pages 516 to 519 of your text. So it's important to know that everybody has their ups and downs. Even when things aren't going well, people can, it's normal to feel miserable, a little pessimistic. And the intensity and duration of the moods are usually in proportion to those events that are taking place. All of that is completely normal. In depressive disorders and the bipolar-related disorders, however, emotions violate the criteria of normal moods. The quality, intensity, and duration of a person's emotional state do not actually seem to accurately reflect what's going on in that person's life. For example, the person may be showing sadness despite the best circumstances, or might be extremely energetic and overconfident with no apparent justification. These mood changes also persist much longer than normal fluctuations of mood that we all would experience. Disturbed moods and emotions are the core symptoms in both depressive and bipolar disorders, which is why they're usually referred to as mood disorders or affective disorders. So major depressive disorder, sometimes referred to as MDD, is a mood disorder characterized by extreme and persistent feelings of despondency, worthlessness, and hopelessness, causing impaired emotional, cognitive, behavioral, and physical functioning. The major symptoms fall into four main categories. There are emotional symptoms, like feelings of sadness, hopelessness, helplessness, guilt, emptiness, or worthlessness. There are feelings of emotional disconnect from others. And there's also turning away from people. People who have major depressive disorder tend to be very withdrawn. Then there are the behavioral symptoms, things like dejected facial expressions. They'll make less eye contact. The eyes are cast downward more often. They smile less often. The movements may be slowed, and that includes speech and gestures. They might become tearful or have spontaneous episodes of crying. There's a loss of interest in pleasure and usual activities. This includes sex, and the person might withdraw from social activities. Cognitive symptoms include difficulty thinking, concentrating and remembering, global negativity and pessimism, and even suicidal thoughts or preoccupation with death. The physical symptoms include changes in appetite and weight, insomnia, early morning awakening or oversleeping, vague but chronic aches and pains, diminished sexual interest, global feelings of anxiety, and restlessness, fidgety activity. So it's important to know that suicide is always a potential risk for people with major depressive disorder. About 10% of people with major depressive disorder will attempt suicide. Now, in order to receive a diagnosis of major depressive disorder, the person has to display these symptoms for 2 weeks or longer. Now, while they don't need to display all of the symptoms, they need to have a majority of them. Now, in many cases, there appears to be no external reason for the person to be feeling depressed. An example of this, anyone who watches the TV show Supernatural, the star of the show, Jared Padalecki, back in 2008, suffered a major bout of depression. The show was actually doing extremely well. He was finally at a point in his life where he was starring in his own show. Everything appeared to be going wonderfully for him. And then all of a sudden, depression struck, and it actually left him physically unable to move in his trailer. And if you look in the notes, I've actually got an article in Psych Central that you can read about this. Now, in other cases, a person's depression could actually be caused by some sort of a negative life event, whether it be something that's stressful or maybe they just have chronic stress. So one specific event that bears its own discussion is the death of a loved one, is bereavement. So previous versions of the DSM actually stated that depression-like symptoms needed to occur for 2 months rather than 2 weeks in order to be considered major depressive disorder. And that was all updated in DSM-5 based on the reasoning that bereavement is like any other psychosocial event that might trigger a depressive episode. While it's normal to feel a sense of loss and deep sadness when a close friend or family member dies, feelings of worthlessness, self-loathing, and the inability to anticipate happiness or pleasure may indicate that major depressive disorder is present. If you have a situation where a person's partner dies and the person becomes sad and inconsolable, that's normal. If the person tries to go back to work a week after the funeral and can't function at his or her job, that's normal. If the person struggles with guilt or with completing daily routines, that's all normal to occur within the first week after a person's death. There is no psychological disorder there. Remember, the symptoms need to occur for a minimum of 2 weeks, and things like feelings of worthlessness, self-loathing, and the ability to anticipate happiness or pleasure are key things that would be needed in order to diagnose a person with MDD. Seasonal affective disorder. So although MDD can occur at any time of the year, people whose symptoms intensify at certain times of the year may suffer from seasonal affective disorder, or SAD. So seasonal affective disorder is a repeated episode of major depressive disorder that are predictable with the changing of seasons. Typically, the onset is in autumn or winter when there's less sunlight. Now, this is still a disputed diagnosis. Some say that SAD is more common among women, and some people say it's more common among those who live in northern latitudes. Others say that depression is completely unrelated to the latitude, the season, or the amount of sunlight, and completely dispute the existence of SAD. Persistent depressive disorder. So this is a chronic form of depression that is often less severe than major depressive disorder. It may develop after some stressful event or a trauma, such as the death of a parent in childhood. The person is able to function adequately, but has a chronic case of the blues, and this can last for years. So now we're going to talk about the prevalence and course of major depressive disorder. So major depressive disorder is often referred to as the common cold of psychological disorders because it's the most prevalent. The most people have major depressive disorder than any other mental illness. According to the World Health Organization, it is also the most devastating of any illness worldwide in terms of its physical, psychological, and economic impact. About 7% of Americans are affected by MDD each year. It is estimated that about 15% of Americans will suffer from MDD at some point in their lives. It's also important to note that women are twice as likely as men to be diagnosed with major depressive disorder. However, there could be some reasons behind this. This might actually be because women experience a greater degree of chronic stress in their everyday lives, combined with a lesser sense of personal control over the events, as opposed to men. And all of that can create a vicious cycle that intensifies and creates perpetual depressed feelings in women. Some researchers, however, suggest that there's actually no gender difference in the prevalence of MDD. It might just be a difference in how the genders display depression. So women tend to show the sadness and all the typical symptoms of MDD, whereas men tend to show things like anger, substance abuse, risk-taking, and none of that gets counted toward diagnosis. There are also cultural differences in MDD. So despite depression occurring globally with similar symptoms, people do talk about it differently. In Cambodia, what they say is the water in my heart has fallen. And in the Haitian world, their word for depression translates to thinking too much. Many people who have MDD don't actually seek help for treatment, and when left untreated, symptoms can last 6 months or even longer and can become progressively more severe. More than half of those who've had an episode of MDD can expect to relapse, typically within 2 years. And the severity increases with each episode, and the time between the episodes will begin to decrease. Now, there are treatments for even the most severe MDD, and we'll discuss some of those in Chapter 14 when we talk about treatments. So that's our discussion of depressive disorders, and the next one will be about bipolar.